Hello and welcome to this online video demonstration of our procedures, practice guidance and tools for adult social care. My name is Sally Gillis and I'm the Adult Social Care Project Manager here at TriEx. TriEx has been providing online procedure solutions to the social care sector for more than 15 years. We work with local authority children's and adult services, independent and local authority children's homes, fostering agencies, regional adoption agencies, and last but not least, safeguarding children partnerships. We are also in the midst of a new development for safeguarding adult boards. We are the market leaders, and across our procedure services, we are proud to work with over 90% of local authorities in England. Until 2017, all services were tailored to the children's sector. However, since our procedures, practice guidance and tools for adult social care was launched, we've steadily grown, and we already have a presence in 4 of the 9 regions of England, including several London boroughs, a county council and a number of unitary authorities. TriEx joined a wider group of like-minded companies in 2019, which together form the Answer Group. Okay, our team is made up of lead consultants. We have a team of lead consultants who are the main point of contact for customers. Some of their functions include managing new developments, supporting practitioners to effectively use the procedures, coordinating planned updates of existing procedures, providing telephone and email support or advice to customers as needed, amending or writing new procedures in response to changes to legislation, case law and best practice, and writing policy briefings and articles for our website. Together, our lead consultants possess an array of social care experience and expertise, having previously been employed as social care managers, social care practitioners, social workers, in legal services, as youth workers and in education. And a number of our lead consultants maintain their professional social work registration and continue to undertake independent work on behalf of SABs and SCPs. Okay, they're supported by the Content Review and Development Board. So they work across TriEx and our sister companies, Reconstruct and Carter Brown. And they work tirelessly behind the scenes, really, to identify and review any changes to legislation, case law and best practice, to consider the best way to integrate changes into procedures or training, and update customers so that they can consider any need to review local resources. We subscribe to relevant web-based resources and attend professional conferences and forums to ensure we have access to the most up-to-date information possible. The production team are responsible for the maintenance of the online procedures and are all highly skilled and trained with an eye for detail. They bring the written procedures to life and work to tight deadlines and are responsible for making sure that everything looks and works as it should do online. Legal support is obviously key, and the legal team ensure that all of the content that we provide to customers is robust, correct and reliable before it goes to publish. Okay, we're supported by IT support and technical development and business administration. Okay, so the procedures, practice guidance and tools for adult social care then. Developed in partnership with a range of practitioners from across the adult social care sector. Okay, so social workers, occupational therapists, reablement workers, finance teams, direct payment teams. Our procedures, practice guidance and tools embed personalisation and strength-based practice and support practitioners to make effective and consistent decisions in line with the Care Act and other key legislation. Okay, so that's kind of in a nutshell what the resource will actually do. Key benefits for practitioners. Okay, so they are accessible. User-friendly and well-structured, as you will see as we go through the resource, relevant and helpful to a range of practice situations. They make sense of legislation and statutory requirements, reflect the needs of all adult social care practitioners, so not just social workers. A range of tried and tested TriEx practice tools are included. They're available 24/7 on a range of devices, so we're not just talking desktops, but we're talking laptops, mobiles, tablets, as long as there's an internet connection. And there are direct links on there to online TriEx resources, the Care Act and the Mental Capacity Act. Key benefits for organisations. More time for local processes and practices. So no need to worry about updating your procedures in relation to legislation and case law. You can leave that to us, which allows you more time. Increased practitioner autonomy and confidence. Use the procedures. you don't need to go and ask a manager straight away. You can use the procedures and see if you can figure it out and gain that confidence yourself. Frees up managers' time for other tasks and projects, complements, enhances training, supervision and CPD. Best practice becomes consistent across all teams. So a big part of what we do when we work on developments is pull out what is good practice, and if it's happening in a little segment of your adult social care but actually would benefit across all teams, it can become consistent throughout the procedures that are written in the localisation. Reduces the risk of challenges or complaints or judicial review. And there's robust archiving, easy and quick to retrieve older versions. Okay. So in terms of development, there are two options. We always endeavour to make all of our procedure developments as easy as possible for customers, and there will be a named lead consultant who will work on the project and also provide ongoing support. There are two development options, and it really depends on how quickly you'd like to go live with your procedures. So option one involves full localisation of our template procedures before you go live. Okay, and there's also then the option of face-to-face launches to ensure that practitioners' optimisation of the site use is there. Option two can be done much quicker. Okay, it doesn't involve full localisation immediately. It involves rebranding and localisation of safeguarding information. We provide you with a video demonstration that can be used to launch procedures with practitioners, and then we work with you after the site has gone live to do the full localisation process. Okay. Testimonies. So there are 3 testimonies on here, which you can obviously see. One is from Telford, and the other is London Borough of Hillingdon and Swindon Borough Council. We work with obviously more than that. We can provide more testimonies. If anybody wishes to have them, then contact me using the details that will be provided to you. And we can provide you with more testimonies. We can put you in touch with people as well if you want to have conversations. Okay, so the demonstration. What we're going to do to demonstrate is I'm going to actually use a live site. So we're going to use Swindon's site to do the demonstration, primarily because it's easier to show you the features on a live site than it is on a template site that hasn't had the localisation. Okay, so this is the landing page of Swindon's site. So you can see we have the logo here. We have the primary colour is purple that has been localised. Okay. What I'm going to do is just walk you through the site and the key features on here. So in terms of getting around the site, okay, there are 2 ways to do it, and it's really down to personal preference and whichever's more accessible to the user. There is a contents page here that sits behind this button, or there are tabs, and you can highlight the tab and go through the tabs. Both do the same thing. The local resource area is a key area that we always get asked about in demonstrations. This is how we integrate all of your local documents with the formatted side of the procedures. Okay, so I'm just going to go into the local resources. The sections of the local resources, you can have as many or as few sections as you require. You can name them as you wish to name them. They are blank during the template procedure process, and the development process is what kind of formulates how it looks. You upload your individual resources to each of these sections. So if I open that top one, you will see that is what the practitioners see. Okay, and then they click on the document, on the link, and it will either open the internet or intranet source it's going to, or the actual document if it's been uploaded to our content management system. Okay, so as you will see, and as I just alluded to, we have internet, intranet documents as well. So it's not just a resource of physical documents, it's everything that a practitioner may find helpful in that particular area. Okay, we have here the type of resource. We have the date as well, that it was added or updated, which can be helpful for version control. So you can also add on their review dates as well, if that's helpful to you, so you can see when things are due for review. It's very straightforward to use in terms of for a practitioner. It's very straightforward to use in terms of administratively behind the scenes and using the content management system to update this area. We provide support and training to the people or person who is going to be responsible for that, because this is an area that is yours to control. We can support with it, but the whole idea of it is that you have full autonomy to add your local documents as and when you need to, remove them if they become out of date, replace old versions with new versions without having to come through to TriEx every single time you need to do that. Okay, but as I said, we are on hand to support. So that is where all of the local resources go. So if you're a practitioner and you are using the procedure site, but you just need a local resource, you can just go to the local resources button at the top here, and it will take you to this section, and you don't need to go into anywhere else to find what you're looking for. Okay. Another area that you have control of here is the news area. Now we provide access to this. It's there really for you to provide information, updates to practitioners from adult social care. It's very specific, and it's down to you how you wish to use it. As you can see, Swindon have provided links to coronavirus resources at the moment, links to their Social Work and Leadership Academy, links to Social Work England, and various other bits of information. So it's down to you how you want to use that. It's helpful to have and useful, and we will provide support in training how to use it, but it's yours to use how you wish to do so. Okay, next to the local resources then are TriEx resources. So these are things that practitioners don't have to use, but they're useful to know that they exist. There are things that we've developed as a company during the development of this model, because the practitioners that we were working with were telling us that there were gaps in these resource areas, and we couldn't find anything out there that existed, so that's why we created some things. So the first thing we have here is a glossary. What you can see is it's opened on another complete window, which means it's a standalone online resource. There's only one version of our glossary. All of our customers access it. When we need to update it, we will do so, and you will automatically get the most up-to-date version the next time that you click on it. Okay, it's very straightforward to use. There are over 400 words on here. It's not just adult social care words. We have health-related words. We have legal words. Anything that we felt a adult social care practitioner may come across and need to know. It's not a dictionary. It is a glossary, so it will give you more than that. More than just the definition. So if I just go to F here, and for example here I'm looking for F under FGM protection order, just to show you as an example really, this is how it appears, but there will be links to external resources that you will see. There will also be links to other keywords in the glossary to help explain and provide a lot more information than you would get in a kind of dictionary format. Okay. So that's the TriEx glossary. We then have TriEx resources. So it looks and feels and works exactly the same as your local resources, apart from it's our resource area rather than yours. So we determine what goes in here, but people don't have to use it. So there's a smaller number of sections. I'm just going to open them up, and I'm not going to go into the individual guidance, but it's definitely worth having a look at. So the TriEx resources are things that we've developed. The external resources are things that we have identified would be really, really helpful for people to know about, but they're not our resources, okay? As you can see, we do review them, so you can be confident that we haven't popped a resource on here in 2017 and just left it. We do review them on an annual basis, or whenever we feel they need to be reviewed, if there's been a change that affects them. Okay, so there's practice guidance here, there's a lot of one-page decision-making tools to support you to implement the Care Act effectively. None of our tools will actually tell you what to do. They will just guide you to make sure that you have followed the correct process before you make a decision about what to do. Okay, so as you can see, we have some around advocacy, ordinary residents is a helpful one. We have some information and advice resources on here. A list of national contacts with information and advice helplines is useful. So some of that information is really helpful to have on there. Okay, and we also have these resources for person-centred and strength-based conversations. When they were originally developed, we did that with a community interest company, and actually got the views of some people with care and support needs, and whether those tools would be helpful for them. So they have kind of been tried and tested, not just by practitioners, but also people who you may kind of use them with when carrying out assessment work or review work. Okay, so I'm not going to go into using this procedure site because it's a self-explanatory kind of tab, and I'll give you a demonstration now. Amendments, this is where a record is kept of things that get changed during your scheduled updates. So in the amendments, there is a list of the procedure that has been affected and what has changed. Okay, so you can see what's changed, when and why. It's obviously really helpful in terms of version control, and if you want to know whether a procedure has been changed at any point in time, you can see that from here. Okay, accessibility. So this is obviously default text. There is large text, high visibility text. We do have some users using specialist software, so JAWS, Dragon, we know is being used effectively. If anybody does use it with and experience any kind of accessibility issues, let us know and we will resolve them. And then there's a search facility as well to search the procedures, but an interesting thing is that we can actually search just the local resources. So if you do have a lot of information in this local resource area here, practitioners can just carry out a search to look for a particular local resource document if they can't find it easily in that section. Okay, so that's really helpful. Okay, I'm just going to go back to the home page now. Okay, so we've covered everything across this top section here. We've looked at the branding and we've looked at the news area. We have a short introduction, which obviously is again self-explanatory and written by yourselves, which contains key contact details for practitioners. Also contains a useful link over to your children's procedures if you have them with us, so that practitioners that do work in that transitional area or managers that might oversee children's and adult services can easily access children's procedures and adult procedures without having to kind of do another search or go onto another site. It will jump across. There is also a little bit here about registering for updates, so that's linked to the amendment tab here. So basically, when something is updated and put into this amendment section, if as an individual practitioner you have registered for updates, you will get an individual email to tell you that there has been an update to your procedure site. It's not something that we enforce and say you have to do, it's just a facility that we provide, and it's down to you how you want to use it. If you want to, we can upload a bulk load of emails to that, or you can ask practitioners to do it one-to-one, or you can, if you don't want to use the facility at all, we can take it out. It's entirely up to you. Okay, so I'm just going to scroll down now. I'm going to use these tabs to navigate the site and show you things. But as I said, you do have at the top the contents page, which will do exactly the same thing. It's just down to your personal preference. Okay, I'm just going to scroll past the big button at the top first off and look at the two legislation tabs on here. So these both link to our separate standalone online resources. So again, every time you click on either the Care Act tab or the Mental Capacity Act tab, you will get the most up-to-date version of our online resource. So I'm just going to go into the Care Act first. Okay, so the purpose of this is to present in a more accessible way part one of the Care Act, so that practitioners can easily understand what their responsibilities are. And if further advice is needed, you'll see here we do have the link to the Act, the regulations and the statutory guidance as well. So in theory, this is a resource that people can go to and it will tell them everything they need to know about the Care Act, be it from the resource or linking to the actual legislation itself. It's very straightforward to use, so we just have an array of sections and we open the section. Okay, and then we go to the area that we're after, click on it. Okay, and we have here our procedure or our information. And the way that we use it, we can either scroll from top to bottom, okay, or everything that's in a heading here, so number 3, number 4, is replicated down this side bar here. So if we're after a particular topic, which quite often people are when they're looking for information, you can just go to the particular area. So for example, if we're trying to find out about an appropriate other person and what that means under the Care Act, we can go straight to number 5 here and it will take us to that section, okay, bypassing everything else. So that's a really good thing, and all of our procedures do that. So this is an independent Care Act resource, but all of our procedures are structured the same way as this resource, so that they all flow and integrate well together. All of our procedures, you'll notice when you go onto them, also have these 2 little icons. So this is obviously the print icon, so you can print a procedure if you need to. We do say with caution, because we don't know whether we're going to be updating a procedure, when it's going to be updated. You don't want to have an old version of something hanging around on paper copy, and also it's not very green printing, but we do provide that facility. You can also email a procedure, which is quite helpful. So if somebody's asked to see a procedure, if you're a manager and a practitioner has asked you for information about what to do in a particular circumstance, rather than giving them the answer, you might want to direct them to the entire procedure site to have a look through that for themselves. Or if you know which procedure it is, you might want to email them over the procedure so that they can have a look at the information for themselves. So that's quite a nice facility. You'll also see as we go through, we have things like important to know boxes. We also use case study boxes, and where relevant, we do use things like tables and charts and diagrams and things like that as well. Okay, so that's the Care Act resource. Just going to go now into the Mental Capacity Act to just give you a little bit of a demonstration of that. Now this is a really, really reputable resource. It's actually been recommended by the National Mental Capacity Forum, and you can also find it on the Social Care Institute for Excellence Mental Capacity Directory. So it is widely used anyway, but it's just the fact that it's linked directly to your procedure site, which makes it particularly helpful and integrated into what you do. Okay, it's slightly different to the Care Act resource, because the Care Act resource is quite high level. So it will tell you what the Care Act says, but it won't tell you how to do that and implement that into your practice. The Mental Capacity Act resource will tell you what the MCA says, but it will also give you the advice about implementing it and the guidance for how to do that on a day-to-day practice level. So the sections Understanding the Mental Capacity Act and Understanding Deprivation of Liberty Safeguards, they are the 2 high-level sections, and everything else is about actually how you do it. So if we want to support people to make decisions and assess capacity, we have guidance around doing that. So this is how you are implementing the understanding sections within the source, okay? There are top tips, there are practice examples. In regards to the Court of Protection, we have guidance on filling out court forms. We have guidance about what to expect if you go to court. What does a courtroom look like, feel like? Who will be there? What's the difference between examination, cross-examination? So a lot of really, really helpful guidance there. And same as the Care Act resource, we also have the link to the Act and to the Codes of Practice, so that if you can't find what you're looking for from this resource, you can go to the more formal guidance if you wish to. Okay, so we're back to the procedures now. So that's the 2 tabs for the legislation that we looked at. The other things that you'll see on the front screen are the kind of go-to procedures, so things that people use a lot, and they don't then have to go into the actual site to get those procedures. Okay, so what we have in this customer's case is we have the adult safeguarding procedure. So I'm just going to go into that because that's a really good one to highlight how we don't duplicate and how we make benefit of existing resources that might sit elsewhere. So in terms of the adult safeguarding procedure, the section Safeguarding Adults under the Care Act, you can see here, all that information sits within the Care Act resource that we just looked at. So we don't want to duplicate it here because it becomes problematic for version control and things like that. So what we do instead is we highlight that that information exists, where it exists, and it's actually linked. So actually if people want to go and find out about the aims and principles of all adult safeguarding, they can click on there and it will take them to that section of the Care Act resource. Okay. In terms of reporting abuse and neglect, so this is a section that we localise. So as you can see here, this customer, we have links to their online referral form. We have their telephone number and email for reporting of safeguarding. We also have the same for children's services. So if you're an adult and you identify a child at risk, you know you can get the information from here. We have information about their adult safeguarding team. Their policy and procedures is held elsewhere, as most customers do have them held elsewhere, be it on the intranet, be it on the internet, be it as a physical PDF document that's uploaded. But either way, it will be somewhere else. And what we do is we click to that wherever that may be. So if I just click this one and see where this one is held. Oh, page not found, excellent. So this one is held on their website. And I need to alert them to the fact that that's not linking. And then the local resources, we have here a range of things on the local resources, this section up here, about actually to support safeguarding practice. So what we do, we click here, it will take us to the local resource section, it will open the safeguarding section so that practitioners can see the supporting documentation that is there. Okay. So that's a good example of how we use available existing information rather than duplicating it, and how we signpost people to it so that they know what it is, where it is, and how to find it. Okay, next to the safeguarding, we have one called requesting adult social care support, which is an interesting one. Not all of our customers decide to keep this one. It's down to you. It's basically there just in case people find this website and what they're trying to do is find out how to access adult social care. Okay, it is on the internet, not behind any kind of login or anything like that. So in theory, people can find it by using Google. People Googling how to get adult social care in a particular local authority will and should quite rightly get your council website with that guidance. If they don't and they do end up on here, then we have created this section and it will just give people that information taken directly from your website about how to access adult social care support, some of the things they can think about before they access adult social care support, information about self-assessment and referral, that kind of thing, whatever may be relevant for you. Here we have assisted technology, and then we have financial assessment, direct payments, commissioning, contracting, and brokerage. Okay. So I'm just going to scroll up now to this big section here that says enter procedures by service or team. So when I go into here, you'll see that we now have 9 further options, and these reflect and will reflect the service areas that you have in your local authority. Okay, the reason that we do this is because when we were developing this model with practitioners, they said it was really, really frustrating and wasted a lot of time if they had a single procedure that was trying to cover every single team's responsibilities and processes, and trying to pull out which bits of a procedure were relevant to them. So by doing this, you know that if you go into your service area, everything that you find in that area is relevant to you. Obviously, yes, there may be some duplication because when something is good practice, it's good practice across the whole organisation, and that's fine. So where there is duplication, then there is duplication. But in terms of how that appears to be duplication for the user, but actually what they're doing is they're all being directed to the same point of information. So actually it's not duplicated for us in terms of version control, if that makes sense. So for the purposes of this, I'm just going to select here assessment and review. And what you will see is you then go to a separate team homepage, which is quite nice. So this customer has decided to write a nice introduction to their team. That is optional, which is useful because obviously it explains what that team does. So anybody can see what that team does. So if it's not clear what the role of a different team or service is, having a little introduction is quite nice for other people as well. We then have 5 sections. Okay, these first 4 sections here is where you may get a little bit of variation behind the team because the process may be different. So a prime one to use as an example for that is if you're an occupational therapist, your section will not contain information about, for example, care and support planning, but it will contain information about providing equipment in care homes. It will provide DFG information, that kind of thing. So I'm just going to open so you can see what is inside each of these. So these sections are all about implementing the legislation, okay, primarily the Care Act. What does it look like, feel like in practice? And generally, how we should implement it, but also at a local level, what supporting documents and things are very, very specific to our organisation, and tying all of that together. Okay, so receiving a contact or referral, deciding the outcome, actions and next steps. Introduction to establishing needs. We have the skilled conversation guidance, so we don't have an assessment procedure. We refer to it as the skilled conversation because that could be a formal assessment process, it could be more of an informal process. Either way, it's that process of gathering the information that you need in order to decide what you're going to do. Okay, eligibility criteria is in here as well. Meeting needs is all around setting budgets, obviously, care and support planning, the signing off of care and support plans and arranging services, and then reviewing those services or reviewing the plan. Full review conversation guidance, light touch review conversation guidance, how to decide the outcomes and what the outcomes might be, including reviewing direct payment. So those 4 areas, there may be a little bit of variation behind the different teams. This final section here, there's no variance, okay? There's a list of independent procedures. They are the same for every single team, okay? They are things that are either more specialist or things that are more general and apply to everybody. So we have an AMP procedure here, Care Cubed, because this customer uses Care Cubed. If you didn't use Care Cubed in your authority, then as part of the development that would be identified, and we would just not include that procedure so that you don't have anything that's not relevant for you. The same here with Care Programme Approach. If you have mental health practitioners that are not based within mental health teams within NHS trusts, then we can remove that procedure. Continuity of care, cross-border placements, death of a person, end of life. So as you can see, they're very practical frontline procedures. Joint packages, joint work, legal services, loan working. You've got continuing healthcare on there, no recourse to public funds, ordinary residents, prisons, protecting movable property and belongings, recognising and responding to deprivations of liberty, risk assessment. Okay, so there's an array. So they are your more specialists, and they are the same, whichever team you work for. They will be the same process, same procedure. Okay, I'm just going to go back to the home page now to just tie in. So I think that what's happened is this has covered everything that we needed to cover, I wanted to cover in terms of this demonstration. You may have some outstanding questions. And you may wish to make an inquiry, or you may want to talk to us and ask further information. Okay, so this is our contact details. So I'm Sally Gillis, so my details are there. My colleague Debbie is also able to take inquiries or information requests. So either or both of us, whichever works best for you. Before we end the session, I just want to run through some frequently asked questions that might cover some of the information that you require. So the first one that we often get asked is around integrating local policies, processes and other resources. So obviously I've shown you the local resource section, but what sits behind that is we provide you with a comprehensive content management system, also known as a CMS. So if you hear that abbreviation from us, that's what we're referring to, which you would use to kind of electronically file all your documents and create a local resource area at the front end for practitioners, which is the bit that we just saw. Okay, so during development, we will support you to use that CMS area. It doesn't need to be a social worker or somebody that is experienced and aware of frontline procedures to manage that section. It can be a business administrator that does that particular task. So it's quite kind of flexible as to who does that task. Again, you have full autonomy, as I said, to add, delete, replace anything in there as you need it, so that it will remain current for you. We quite often get asked how much time is needed during developments. It very much depends on which development you kind of go for. The option 2, where we get it up quite quickly and all we do is rebrand and get the adult safeguarding information, requires very little information from you, obviously. Probably about an hour of somebody's time to just answer a few basic questions so that we can make sure that we set it up as good as it can be for you. If in terms of the bigger part of localisation and development, In 95% of cases still, there's actually nothing that is required to be done. But you can review. So if you want to review all of the procedures on the site, if you want to request changes, add in local bits of information, etc., you can do that, but there's no requirement to do that. It will work if you don't do that still. So you can make it as time consuming or as untime consuming as you like. The biggest bit for you in terms of your local time is always the local resource area and collating all of that information that sits across all of your teams and services that is used in day-to-day practice, be it forms, templates, process maps, guidance that you have, links to websites that people use, because you will be quite surprised how different teams use different things. And they may have different versions, so you may need to look at which version is the one that you want to include, etc. We can support with the initial upload of that. We can support in helping you to collate that information and decide how to section and structure that area. That's probably the biggest bit of time that's needed. How are procedures maintained is quite often a question, and what's the ongoing support from us? So as I mentioned, we have a content review and development board that meet regularly to review the changes that may be required, and whether or not we need to update a procedure or update some of our guidance or just notify you of the change so you can think about the impact on your local resource. We do have scheduled updates which are provided twice yearly as part of the contract. This is where we say to you, these are the things that need to be changed because in response to those higher level changes, and you have an opportunity to say to us, these are the things that we would like you to change. And the scheduled updates are available pending our capacity to do them. They may come at an additional cost unless they're related to safeguarding, when we will make those changes as a priority. You will have a named lead consultant throughout your period. It's normally the person who has helped supported you on the development will continue to manage your contract. They will manage that scheduled update process, but they can be contacted by phone or email at any point to provide advice or support. Can I monitor how the procedures are being used? Yes, so we provide you with access to data through Google Analytics, which allows you to monitor general usage, but also specific procedure use, which can help you identify potential training and development needs across the organisation. It's down to you whether you want to use that facility or not, but we do provide it for you. Can I access old versions of the procedures? So whenever your procedures are updated, the old version is archived by us and we can easily retrieve it whenever you may need it. So in terms of what we do during a development, you don't ever lose your procedures for any amount of time. What happens is our production team take an exact copy of your online site. They work on that exact copy to apply all of the amendments from the scheduled updates. When those are done and they've been approved, what happens is they simply switch the sites over and archive the older one. Okay, so that's how it all works. What are the contract options? We quite often get asked. So there are 3-year and 5-year contracts available, but you can also find us on the G-Cloud framework where 2+2-year contracts are also available. Okay, I think that is the bulk of the questions that we normally get asked during demonstrations. So anything else, just give us a shout, give me or Debbie a shout. I hope that this has been helpful to you. We'd love to speak to you. As you appreciate, these things are much better face-to-face when we have an opportunity to answer any questions you may have. So please do get in touch and we look forward to hearing from you. Okay, thank you. Bye-bye.